Welcome to MD Longevity Lab, where we're playing the long game. This is a podcast where science meets real life, with expert insights, practical tips, and real-world tools to not only live longer, but live better. Our aim is to radically change the way medicine is practiced and enable individuals to age gracefully, maintaining health span and vitality well into their later years. We're your hosts, Dr. Nisha and Dr. Vikas Patel, physicians, partners in life, and parents balancing work, wellness, and everything in between. Let's dive in. Hey guys, welcome today to the MD Longevity Lab podcast. We are going to dive in today to perimenopause and menopause, all the changes that happen, why they happen, and how to navigate them without losing your mind.
Here's the truth. 50% of the population will go through perimenopause and menopause, and the other 50%, you guys, will have a partner, parent, sibling, or friend going through it. So in other words, this transition affects every single one of us. So listen up. I'm going to rant, and this is not a perimenopausal rant. This is a scientific one. Until 1993, just 30 years ago, women weren't even required to be included in U.S. clinical trials. A review in the New England Journal of Medicine showed that for decades, most studies enrolled only men, then applied the results to women as if our physiology is the exact same. And spoiler alert, it's not.
Yeah. And you still see the ripple effects today, right? So there's over 26 different FDA-approved drugs just for erectile dysfunction, but there's only 2 FDA-approved drugs specifically for menopause. So 100% of women are going to go through menopause, yet it has fewer medicines than something only a fraction of men are going to experience. If that doesn't make a woman want to flip the table, I don't know what would.
I definitely want to flip a table when I hear that. Anyway, thankfully, the tide is shifting. There's leaders like Dr. Mary Claire Haver, Dr. Gabrielle Lyon, Dr. Wanda Wright, and many others who are raising awareness and paving the way and making women's health part of the mainstream conversation. That's part of why we're here, to keep pushing this forward.
Let's be real. Perimenopause can feel like, your body's betraying you sometimes. You're eating the same, you feel like you're exercising the same, and then suddenly your clothes don't fit right. It feels like your body's just breaking all the rules.
Yeah, and add to the noise conflicting advice from TikTok, supplement ads, influencers. It's pretty overwhelming, and there's no wonder so many women just throw up their hands and say, forget it, I'm not doing anything.
Yeah, so the point of this is to empower you, first, to understand what's actually happening in your body, and second, to focus on which levers to pull that would actually move the needle in the right direction.
So today we're breaking down perimenopause and menopause 101, the science, the physiology, and the real life experiences. And we're going to do a brief overview on how to optimize this transition so you feel strong, sharp, and vibrant for decades to come.
Right. So what is perimenopause and menopause?
Menopause itself is defined as 12 months after your last menstrual cycle. So it's basically just one day. The average age in the US is 51, but more importantly, perimenopause is a time period that can span 10 years before menopause actually happens.
So what's really happening in perimenopause and eventually menopause, it's really kind of what's going on under the hood, right? So estrogen and progesterone levels are fluctuating, and then ultimately they decline. Estrogen receptors are basically everywhere in our body, right? So they're in the brain, they're in the bone, muscle, skin, our heart, our gut. It's like your Wi-Fi is getting shut off and suddenly every device in the house is glitching. This is also why there's so many different ways that symptoms show up, right? So there's hot flashes, there's mood swings, there's brain fog, there's sleep issues, bone loss, muscle loss. It's not just in your head, it's literally everywhere in your body.
Yes, let's go through some of the physiology and the data. Estrogen isn't just about reproduction. It is responsible for protecting bones. It supports insulin sensitivity. It maintains muscle. Estrogen even impacts the brain and heart. Without estrogen, metabolism will shift, and studies show that women gain an average of 1.5 pounds per year after menopause. And that's mostly belly fat.
What actually happens during this whole process, Nish?
Yeah, menopause impacts everything. And today we're going to go category by category through all the body systems and what actually is happening under the hood with perimenopause and menopause. The first organ system we're going to go over is lean muscle mass. And you've heard us say before that muscle mass is the organ of longevity, right? Or the currency of longevity. And this is impacted significantly by perimenopause. After the age of 30, we lose about 3 to 8% of our muscle mass per decade. But after the age of 50, muscle loss accelerates and can get up to 10%.
Wow, that's a crazy amount of loss of tissue, right?
Yeah. And what does less muscle mass mean? It means your metabolism is slowing down. Muscle is one of your biggest calorie burners. And you taught me that, right? If you have less muscle, you also have a higher risk of falls, fractures, and there's loss of independence. And you also have a greater difficulty maintaining good posture with less muscle. So, resistance training isn't optional for women going through perimenopause or menopause. It's essential. Pilates, stretching, mobility training, body weight exercises, these are all helpful, but alone they do not provide enough stimulus to preserve or grow muscle when hormonal protection declines.
I think people can incorporate those things, right? But generally, they're not doing them until they're fatiguing, which is what the real problem is. Like, the movement is great, but if you're not doing movement until you're actually fatiguing, you're not providing enough stimulus to keep the bone density, keep the muscle mass. Let me cover a little bit about bone density here. Women can lose up to 20% of their bone density in just the first 5 to 7 years after menopause. And the kicker is, we're not really prompted to check women's bone density until the age of 65. And so the only time that that's done is if you've fractured early, that we might check your bone density earlier with a DEXA scan. It's really like inspecting your brakes after they've already failed, right? This is reactive rather than being proactive. Really, women should be getting their bone density checked much earlier than that, in their 40s, so that they can have a good sense of where they're starting at before they get to that bad place where we've already had a substantial bone loss. And the best way to do that is by getting that DEXA scan earlier in life. Nearly 1 in 2 women over 50 are going to break a bone just because of osteoporosis. And I think we've mentioned this idea of what happens with the really large bone fractures, right? Hip fractures. And that's really why this early detection thing matters so much.
Yeah. Let's go to the next organ system and we're going to cover visceral fat. So during perimenopause and menopause, fat storage shifts from your hips and your thighs to your belly. We've gone through this in previous episodes where subcutaneous fat, the fat that you can pinch, that's right underneath the skin, is very different than visceral fat. Visceral fat is that dangerous inflammatory fat that lies in between our organs in our abdominal area.
After menopause, I think, we all have the picture in our mind of the men with the pot belly, right? All of the estrogen and progesterones are protective for women from developing that. Once they lose the estrogens, then they start taking on a similar body habit as to what men do when they're eating excess calories.
Yep. Premenopausal women carry 8% of their total body fat in their visceral area, measured by whole body DEXA scan. Contrast that to postmenopausal women, they carry 23% of their total body fat in their visceral area. That's a quarter of their total body fat that is now shifted into their abdomen. That's huge. And we know that visceral fat is that inflammatory, radioactive fat that exacerbates every chronic condition.
Yeah, I knew that that shift happened. I didn't know how stark the difference in the numbers were between pre and post menopause. That is unbelievable.
And there was a 2021 study in the Journal of Clinical Endocrinology and Metabolism that showed that that decline in estrogen is directly associated with increased visceral fat, even when your BMI stays the same. So menopause may not necessarily make you gain more weight, but it does change where you carry it. So for women out there who aren't eating much differently than they were 10 years ago, but they're gaining weight, they're complaining about their midsection getting bigger, it is not in your head. This is the physiology changing during perimenopause and menopause.
Yeah, that's super interesting. So let's shift gears a little bit here to what happens with our cardiovascular system and lipids, which is our cholesterol, right? So estrogen actually boosts for women their HDL levels and it reduces their LDL levels. And I notice this all the time between my men and women patients who are premenopausal that in general, women just have much higher HDL levels than men do.
Can you clarify what HDL and LDL?
Yeah, so HDL, that high density lipoprotein, that's the lipoprotein that binds cholesterol molecules that's actually somewhat protective in our cardiovascular system. This is part of the reason, not the whole reason, but part of the reason why pre-menopause, women have a lower rate of cardiovascular disease than post-menopause. And that's also part of the reason why at age 45 for men, we say that their age is now a risk factor for heart disease. However, for women, we don't consider their age a risk factor for heart disease until 55 when they've lost that estrogen. And now they've had that change between their HDL and LDL ratios. So, HDL, one of the things that is good about HDL is that it, other than the fact that it does decrease our risk of cardiovascular disease, these interesting things that occur with perimenopause and menopause, HDL goes down and estrogen actually helps us synthesize HDL. And so when estrogen leaves the system, women are no longer synthesizing that extra amount that is somewhat cardioprotective. LDL also increases as estrogen goes down. And LDL is that cholesterol that we tend to say is, or the particle that binds cholesterol that is a little bit more dangerous to us because it gets trapped inside of the artery walls and it causes those plaques. And so women start to develop the exact same risk that men have had for a decade earlier. In addition to that, triglycerides often also rise. And triglycerides, these are the particles in our body that tend to move all of the carbohydrates and the fats throughout our system. And so if those are going up, we end up developing more insulin resistance and more plaque burden in the body. These shifts are really part of that larger explanation of why cardiovascular disease becomes the number one killer for women in the postmenopausal period. It isn't just about aging, it's really about these hormone transitions that are affecting the lipid metabolism down to a cellular level. And, you know, in a 2020 review, it showed that LDL cholesterol went up by 10 to 15% on average in just the first year after menopause has set in. And that was completely independent of other lifestyle factors.
Yep. So we've covered muscle, visceral fat, bone health, cardiovascular health. Now let's move to sexual health. As estrogen levels drop, your vaginal tissue becomes thinner, drier, and less elastic. So that can make intimacy uncomfortable. And when sex hurts for women, it's no surprise that desire goes down. On top of that, testosterone levels, we normally associate testosterone with as a male hormone, but women's bodies produce it in healthy levels, which women need in smaller amounts. Those start to decline as well. That double whammy can significantly lower libido. And it's not just physical changes. All of that can chip away at confidence, energy, and connection.
So what you're saying is it's not me.
It's not you. Well, sometimes it's you. The biggest turn on is when you do the household tasks. If I come home from work and the dishwasher's loaded,
I feel like we should get back to the medicine.
like
Let's talk about menopause.
I understand the double standard because if you said that to me, I'd be livid and probably flip this table.
No comment.
Anyway, studies show that 40 to 50% of women in perimenopause report sexual concerns, but most of them never mention it to their doctor. Too many women think it's just aging or that nothing can be done. And here's the truth: intimacy does not need to expire. There are so many tools that can help. There's lubricants, vaginal moisturizers, pelvic floor physical therapy, local vaginal estrogen, testosterone therapy. But beyond hormones and treatments, this is about confidence, relationships, and quality of life. Sexual health is a big part of our health. It's not a luxury or something you need to give up as you age.
And I think it's helpful to have a conversation with your partner also about what's going on because they should have buy-in and be trying to help address whatever these concerns are also, by doing the dishes.
Yeah, doing the dishes. No, we've had these conversations and they're not always comfortable, but I think it's important to say, I love you, but I'm just not feeling it today.
All right, moving on from
Well,
that super comfortable topic.
if my in-laws or my parents are listening, the only 3 times where we've been intimate is when we've had children.
Yes, correct. And if our kids are listening.
Yes.
All right. So moving on from that topic, I'm going to cover a little bit about metabolic health and what women's estrogen plays a role with that. Essentially, estrogen is enhancing insulin sensitivity and glucose uptake into muscle tissue. As estrogen declines, you generally develop a little bit of insulin resistance, and particularly in the visceral or abdominal fat area. Postmenopausal women have a 60% higher risk of developing type 2 diabetes compared to premenopausal women of the same age. And this is why you may feel like you're still eating the same and exercising the same, but your metabolic machinery has changed, right? So this is a confluence of factors. If you are losing a little bit of muscle mass because you no longer have the estrogen and subsequently testosterone, and you are increasing a little bit of that visceral fat, then this is the perfect combination for developing insulin resistance, which is why there's this 60% higher risk. And all of a sudden, you had normal blood glucose all of your life. And then your doctor's like, hey, we need to put you on some metformin or one of the newer drugs like the GLPs. This is part of why if women are aware of what is going to happen, then we can institute some changes before they get to that point. Obviously, if you're already at that point, there's tons of things that we can do. And we will eventually cover some of these options on what to do if your doctor is telling you, hey, look, you've got some insulin resistance.
Okay, let's move to skin and hair changes because these changes are some of the most visible and often the most frustrating when it comes to perimenopause and menopause. Estrogen is a key player in maintaining collagen, elastin, and skin hydration. After menopause, women can lose up to 30% of their skin collagen in the first 5 years and about 2% more each year after those postmenopausal years. And that's why your skin starts to feel thinner, drier, crepier, less elastic, and why fine lines and wrinkles seem to appear almost overnight. And hair is affected too. With lower estrogen and progesterone levels, your actual hair follicles shrink. This leads to thinning on the scalp, and at the same time, your androgens become relatively more dominant, which is why some women notice new chin hairs or upper lip hair, and it feels unfair. You lose it where you actually want hair growth and you gain it where you don't in the most inopportune areas. The good news, there are lots of strategies. We recommend our patients have a consistent skincare routine with excellent medical grade sunscreen, moisturizers. We also incorporate tretinoins, retinols to help protect and restore. In addition to a good skincare routine, strength training improves circulation and growth factors that benefit both skin and hair. This is so important. I try and go through this with my patients. It's great that we're doing Botox, good skincare, but strength training actually really improves blood flow and benefits both skin and hair.
So, my takeaway from what you just explained is that we watched Big Daddy with the kids. I don't know if you guys remember that movie with Adam Sandler. So, the reason why old men have wrinkly balls is because they've lost collagen.
Actually,
I mean, that's what you said, right?
Is that what you told our kids?
No, but that's my takeaway from this, what you just
I'm
taught me.
I'm glad that this was your takeaway.
Okay, it's kind of like postmenopause.
We don't have balls.
Moving on. Let's cover a little bit about brain health. Estrogens don't just influence reproduction, right? It is a huge, huge player in brain chemistry, and it supports numerous neurotransmitters in the brain, some of which most of you are familiar with and have heard of, things like serotonin, dopamine, and acetylcholine. These are things that help to not just regulate the communication between cells in the brain, but many of you have heard that these are the things that are responsible for symptoms such as brain fog or mood swings, memory lapses. This is really why perimenopause and menopause are strongly associated with mood disorders, because as you start to lose the estrogen, these symptoms start to set in, and rates of things like anxiety and depression typically climb quite a bit during that postmenopausal phase. So there's this long-term brain health story, and it's kind of sobering. Women make up about two-thirds of Alzheimer's cases. And part of that is just this biology, right? Declining rates of estrogen ends up removing an important neuroprotective layer for them. And if you combine that with the other risk factors, like they start to develop insulin resistance, they start to have poor sleep quality because of things like hot flashes, they aren't seeing the same amount of gain from their exercise, you have now set up this perfect storm for developing cognitive decline. There is a silver lining, there is a hopeful side here. You actually have a lot more control over this than you might think. We harp on this exercise thing. Resistance training is not just about looking toned, it improves blood flow to your brain, it enhances growth factors that support our neurons, and it reduces that inflammation, right? So many people talk about inflammation and high cortisol levels and your CRP, high sensitivity CRP being elevated. These are all things that resistance training reduces. So good sleep is another thing that is, essentially it's this nightly brain housekeeping, and it helps to clear out all this metabolic waste. Your metabolic health, keeping glucose and insulin in check, protects the brain from damage of high blood sugar and vascular disease. Having good sleep allows us to remove some of that metabolic waste. Resistance training helps to improve our sleep. Plus, it helps to increase blood flow to enhance those growth factors. These are all things that we can do to help improve our long term outcome with perimenopause and menopause. And then on top of that, for some women, hormone replacement therapy can provide that extra layer of protection. And when it's started at the right time, it's the perfect solution to keep things moving in a very protective fashion. Dumbbells are part of that memory care plan. And every squat and deadlift isn't just to help your muscles and bones, it's this huge investment in keeping your brain sharp for decades to come.
Yeah, and tying nicely into that topic, let's get into sleep. So, sleep is one of the biggest casualties of perimenopause and menopause. Between hot flashes, night sweats, shifting hormones, insomnia becomes a real problem. I know you've seen me evolve over the years, and now I have my weighted blanket, my sleep mask, my sound machine. I have my whole routine to try and get decent sleep. And even then, sometimes it's not possible.
I'm definitely going to take a little picture and video clip of what you look like at bedtime.
It's basically like Disney's Sleeping Beauty.
It is super attractive.
Good sleep is priceless.
It is.
And it's so
As you're
hard.
telling us.
It's so hard. In fact, studies show that up to 60% of women report sleep disturbances during this transition of perimenopause and menopause. And poor sleep isn't just an annoyance, it creates this ripple effect across your health. Lack of quality sleep increases ghrelin, which is this hunger hormone, while lowering leptin, which is your satiety hormone. Ghrelin makes you feel more hungry, and poor sleep increases that. Leptin is the satiety hormone, and this tells you when you should be full.
This is, for people even outside of menopause, perimenopause, like This is exactly why if I work until 3 a.m. and I come home, right, and I don't sleep that much, this is why the next day I'm like wanting to eat. I did not get enough sleep, and some of it's psychological, like I deserve this,
Yeah.
but
I earned this.
I earned this, but literally from a hormone perspective, like my body's actually telling me that I deserve it. It isn't just like the mental part of it. From a hormonal perspective, my body's telling me that I need this. And in the postmenopause phase, like that's what's happening, right?
Yeah, your ghrelin is telling you, I need to eat more. Your leptin, which is declined, is telling you, I'm not full. I need to eat more. So, translation is you wake up craving sugar, carbs, and it's a lot harder to resist that mid morning muffin and go for the protein shake. On top of that, sleep deprivation raises your cortisol, which is that stress hormone, and that drives fat storage, especially around the midsection, which we touched on, and worsens mood swings and anxiety. This is why so many women feel trapped in this vicious cycle, right? So they get menopausal symptoms, which causes poor sleep. Poor sleep worsens weight gain and cravings, which then feeds back into more symptoms and more stress. And honestly, if you scroll TikTok at 2 a.m., it all makes sense. Half the feeds look like a late night QVC ad, cooling pillows, ice packs, weighted sleep masks, bands you clip to your nightstand. Everyone looks for that magic fix. The truth is, there are some gadgets that can help, but the foundation still matters, right? We want to keep the bedroom cool. We want consistent sleep wake time. So even on the weekends, wake up at a reasonable hour, strength training and daily movement. So this tires you out, which improves your ability to fall asleep, cutting alcohol and late night caffeine. We have certainly trimmed down on alcohol. Of course, there's nights like last night where we enjoyed ourselves, but alcohol disrupts sleep architecture. So you really are picking between alcohol or sleep. We just know that going into an evening, if I'm going to drink, I know that I'm compromising my sleep. And sometimes that's the case and that's okay, but it's a trade-off. The takeaway is that sleep isn't just rest, it's the cornerstone of metabolic health, brain function, and emotional resilience. And during perimenopause and menopause, it's so important to protect it and that becomes even more critical.
Yeah, I think it's worth summarizing some of what we've gone over here. I hope you guys can see a little bit of a common theme here. Perimenopause and menopause aren't just about the hot flashes or the irregular menstrual cycles. They literally touch every organ system in a woman's body: your brain, your bones, your muscle, your metabolism, your heart, your skin, your sleep. There's nothing that escapes that ripple effect of these hormonal changes. And that's why so many women feel like everything is shifting all at once. And it's doing so in so many different ways. This is also why we have to move past the idea that menopause is just a natural phase that women have to suffer through. It's a pivotal transition. And I think when you understand what's happening and also have the right tools, you can protect your long term health and really thrive through that period of life.
Yeah, and let's go through how we arm our patients going through perimenopause and menopause during this transition before symptoms even begin.
So that means a few things, right? It means that we're dialing in the nutrition and making sure that they have adequate protein intake. That needs to continue through the entire cycle of going through perimenopause and menopause. We dial in the resistance training aspect of this and make sure that our patients are using an adequate amount of weight or resistance, that they're fatiguing themselves appropriately a few days a week. We're also targeting the right supplements to use to make sure that they are maximizing their bone health, how much resistance training they can actually do, and what supplements make the most sense based on their metabolic numbers. When it's appropriate, we're also then saying, okay, HRT or hormone replacement therapy may also make sense. And it's the combination of all of these factors, right, that is going to protect a woman for the long run.
Yeah, but I think that's important to note that HRT, hormone replacement therapy, is not a replacement for lifestyle. Hormones are not going to lift the weights or do the meal prep for you. That's on you. And so patients that are seeking HRT without understanding that it's a commitment to also doing the lifestyle modifications, it's kind of futile.
Yeah, I mean, if you're insulin resistant before you start HRT, you're going to be insulin resistant after HRT. Like, HRT isn't fixing pre-existing problems. Like, if you aren't moving right now, you going on HRT isn't going to all of a sudden magically make you start moving. The things that are fixed problems that are our quote unquote lifestyle deficiencies, I guess, they're going to continue one way or another. HRT is just another tool that can help to protect women from having some of these really big bad outcomes that we don't want them to have.
Yeah. I think of HRT as power steering. You really have to know how to drive, but it makes the ride smoother and you're still driving the car, right? So you still have to eat the protein, lift the weights, sleep. And these are all things that I kind of took for granted. I remember when I underwent my first longevity testing and I had a ton of blind spots to work on. And this is before I had started with these perimenopausal symptoms. And I learned that I had to start putting on some muscle mass in order to ensure myself in the long run. Because ultimately, putting on some muscle is going to help me with perimenopause and when I go through full on menopause.
I think we're going to talk about this again later and talk a little bit more about what HRT allows women to do and how safe it is and how it's actually prescribed. That when combined with all the rest of the lifestyle modification can really give women everything that they would want in the long run. Menopause is not the end, right? It's just this transition. And with the right strategies, it should be empowering. It should be intentional. It should literally be kind of freeing and liberating for women.
I definitely feel like it's freeing because perimenopause has given me that freedom that you only have X amount of energy. You have a finite amount of
Best to give.
Yes, I have a finite amount of Fs to give. I say that to Vikas all the time. There's X amount of Fs, and if I've expended most of that Fs, I have nothing left.
I just want to be clear. Perimenopause empowered you to say that?
Yeah, I think I was saying that when I was in my 20s, but perimenopause is certainly amplified that. That's for sure.
All right, guys. I think that's it for today. Thank you for joining us on the MD Longevity Lab podcast, where we are playing the long game. If you found this episode helpful, please share it with a friend. Please subscribe so that you don't miss the next one.
Yep. Until next time, take care of your health and keep playing the long game.
Thank you for playing the long game with MD Longevity Lab. You can visit us at www.mdlongevitylab.com to learn more about how we can support you on your journey. Stay connected with us on social media at MD Longevity Lab for tips, updates, and behind-the-scenes insights. If you enjoyed today's episode, we'd love it if you subscribed, left us a rating, or shared it with someone you know who's also playing the long game. Thanks for listening. We'll see you next time.